Welcome to a special edition of Medicine of Meadville. I'm Dwayne Kohler from Meadville Medical Center, and we are at Vernon Place today, and we're joined by two people that you may have met before on our Armstrong shows. Terry Beck, we're going to talk about the new radiology thing that's going on here at the Vernon Place.
Good, yes.
Pretty exciting. I'm looking forward to a tour here. I haven't seen anything of it yet, so I'm looking forward to that.
Good.
Kayla Waltman, you are a senior at Allegheny College.
I am.
And let me say publicly, thank you for the things you've helped before. You were our kayak demonstrator this summer.
Yes.
Now you're an award-winning kayaker, by the way, after going to the Paddle Fest. But tell your story. Tell what's going on.
I try not to brag too much about the award-winning.
Okay.
But I'm currently looking at applying to grad schools, and I decided to come here today to shadow you. Thank you for the opportunity.
So which kind of grad school are you thinking of?
I would like to get my master's in health administration, so I could be a hospital administrator.
That's
eventually.
great. Well,
Yes.
we're thrilled about that. So I'm kind of hoping you can throw some good questions in here from a different perspective, because I probably asked the same questions. Have I asked you the same questions, Terry, about a million times before?
No, you're good.
Well, what can we see today here?
Well, today there's still some confusion out in the community as to what is in this building. So we're going to do a tour of the radiology suite. We have CAT scan up there. We have mammography. We have ultrasound. We have just your basic general X-ray, and we also have MRI that we're going to tour.
So I'm looking forward to seeing all those things. And if I'm going to need to have one of those tests that you mentioned, how do I decide if I'm going to have it here, if I'm going to have it at the hospital, or how does that work?
That's a good question. And there's a lot of confusion on that. We're trying to clear it up. It all starts with the ordering physician.
Okay.
The ordering physician will call our scheduling line, and at that point we will make a decision of where to go. And then they will relay that to the patient.
So you think all the staff upstairs is going to show us, or are they going to hide from us whenever we come to their departments?
They typically run and hide.
Okay.
No one wants to be on television.
Okay. Well, you'll take care. You'll take it.
That's right.
All right. Well, let's check it out.
Okay, let's go.
So, Terry, what goes on in here?
This is our multi-purpose Flora Room. We can do general X-ray, and we do morning barium studies, the barium swallows, where the patient will drink the barium, and we follow it down, look for any kind of abnormalities in the stomach or the esophagus.
So I like video. So Flora, that's like a videotape, right?
It is. If you look behind you, these new. You can run it's like a joystick. You can run it here, or you can go behind the console back here, and you can control it from behind there.
So we're going to see some other things too, but do people need to be afraid about being exposed to radiation when they're having a test?
No. The new equipment has dose reduction, radiation packages on all of it, and we follow the ALERA regulations set up by the ACR.
Is that scary, Kayla?
Well, it's kind of scary thinking about it, maybe exposure to radiation, but with what you're saying about the new technology being safer.
We shield, we call it time, distance, and shielding. You want to stay, you're in there the least amount of time. You want to shield the patient, and distance, you want to stay at least 6 feet away from the source.
So if we're looking
as
at
a
something here,
technologist,
if we're looking at something here, you're going to cover the rest of me up with a.
There's actual lead cones in these, so we can cone in on the region of interest.
Okay.
Interesting. Well, I'm looking forward to seeing some more stuff.
Okay.
So Terry, ultrasound, what happens here?
Ultrasound, we have 4 ultrasound machines up here at Vernon Place. We can do a lot of our outpatient studies here. All kind of babies we do up here, pregnant mothers, gallbladders, your basic general ultrasound we do here. Anything that requires a physician, like an ultrasound biopsy, we still do those at the hospital.
So X-ray, it's radiation. MRI, it's magnets, right?
Correct.
Ultrasound, it's actually like sonar. I mean, it's like
correct.
It's like sound waves, right?
It is. And CAT scan is our other radiation producing.
So sound waves. I mean, there's like nothing bad to you that comes from that, right?
That's
I mean, there's
correct. Yes.
There's no lifetime exposure that's going to make you sick or anything.
The techs will take a probe, put the gel on your belly, and they take a picture.
So the only bad thing is it tickles, I guess, huh?
I guess so. It could be cold. We do have gel warmers on the balls there.
Okay. So there's still ultrasound at the hospital.
Correct.
So how do you know if I have it there or if I have it over here?
At the time of scheduling, The scheduler will actually tell you that you are to report to Vernon Place for your procedure, or you're going to go to Liberty Street Hospital for your procedure.
So am I going to get in and out of here quicker? I'm guessing I will.
You will. We are trying to funnel, actually we're doing about 49% of our ultrasound exams up here. At the hospital, we have lots of inpatients that we do. We do a lot of our vascular specialty studies there, and all of our emergency room patients. And that's still a large volume.
Kayla, you've been in the emergency room, and it's like when you're there, it seems like everything takes forever.
It does.
But it's like if you're on the other side of that, and hey, I'm just in here for a quick study, probably better off coming out, to the outpatient side, right?
I would say so, yeah. And it's a beautiful building, so you get a nice view on your way in.
And look at the great birds on the wall. Jeez,
Yes.
what could be better than that?
Yeah, that's the purpose of this. We want the viewers to know that, Vernon Place is here. A lot of the community members are still drive by here and say, what is that building? They don't know we're here yet.
Okay, we're going to find out after today.
That's right. That's why we're here.
So Terry, this is the CAT scan, but I don't see any cat anywhere. What's up with that?
There's no cats here.
There's no cat?
No
Okay.
cats. This is our newest CAT scanner. Meadville Medical Center has 4. Again, this is outpatient. You're in and out of here. This is a Toshiba 40 slice. It's very, very, very high detailed.
What does 4D slice mean?
Every time this X-ray tube goes around your body, it takes 40 pictures.
So that means
40.
So that means that if my head's in here or my chest is in here, it's going to be divvied up like
Right.
in real small.
That's right.
Real small slices.
Basically, if you think about it, it's going to cut you like this. Cross-sectional anatomy,
Okay.
all the way down. And we can do you from head to toe in about 9 seconds.
Wow.
So this is an X-ray. So I'm thinking of an X-ray as I can see my broken arm or whatever. Can I see if there's
Yes.
some other medical problem? Tell about that. If
You
would.
can do that. These are, we can take very thin slices. So if there's a hairline fracture that a basic X-ray cannot find, the physician will order a CAT scan. So we'll take very thin slices, and then we can send them back to our computer. They can reconstruct them we can do and create a 3D model, so you can actually see very fine.
Now, what about if I was exercising and I lifted too many weights and I thought I might have had a hernia? What about that? What about that, Kayla? You think anyone ever do something like that?
I've heard it's possible.
It's possible.
Happened before.
Yeah. So can you find soft tissue kind of stuff?
Oh, absolutely.
With
Yep.
the CAT scan?
Yep. Soft tissue. MRI is more geared towards soft tissue, but yes, appendicitis, any kind of soft tissue abnormalities we can find. Yes.
Now, one thing, historically, I've heard people, I don't like those machines. They give me claustrophobia, whatever. I mean, to me, that doesn't look like. You don't feel like you're. Well, let me ask you. Do you feel like you're in a tube when you're in there?
The CAT scanner's not so much, but I'm not claustrophobic, so. The new tubes are actually, the gantries are larger. This is a 72 centimeter bore, so you do have more space.
So it doesn't matter, big person, small person, pretty much anybody could fit here?
This table will hold up to 500 pounds.
Okay. So what kind of things, I know at the ER, it seems like the CAT scanner is going like all the time. What kind of things are going there? What kind of things are going to go on here?
Well, basically, we do abdomen and pelvises here, chests, a lot of heads. We're doing a lot of orthopedic studies here.
Okay.
Since across the hall
ortho
is our orthopedic
upstairs or
office.
next door. Okay.
Thursdays is our orthopedic days. We do probably 10 to 15 specialized knees for Dr. Molly.
Okay. So even when you hear, so did they have one of these at the stadium? Like you hear the football player gets banged in the knee and he runs off and he's going to go get a test?
I don't know if they do or not. I know in Heinz Field they have an X-ray room. Whatever, if it's a CAT scan or not, I don't know that. But
And it seems like sometimes they're right back.
They probably do.
Pretty quickly after. So, well, ours is better, right? Because it's here and it's
here.
available to anybody.
Yes.
So, okay. So CAT scan, you don't need to be afraid of it. It's radiation, but again, you're in a very controlled
Very
situation.
controlled environment, yes. And again, this has a low dose package on it, and is kind of intuitive, and we do it a scout image prior to starting, so the computer will gauge on your body habitus. So if it needs more X-rays, more dose, it'll kick it in.
Now, one thing we talked about this before. I think the last time we did something, but we're not making film anymore. Now it's all going to be
It's all digital.
and
It's all on a network.
is
Yes.
the doctor nearby? He doesn't have to be, right?
No.
I mean,
No, we have doctors that are down at the hospital. We do have one here on the site just for safety reasons, but after 5 o'clock, we ship things to Australia.
So it doesn't matter if it's doctor's having lunch break or he's home sleeping in bed. There's somebody that's going to be able to watch.
He could be in his car and pull it up on his iPad and look at images if he wants to.
So things have changed.
Things have changed. No film. You can carry it all around on your iPad.
Well, pretty impressive. Joining us now is Jill Post. Jill, welcome to Medicine in Meadville, and thanks for showing us here a little bit about the Women's Imaging Center. So what do we see here?
This is our mammography machine. This is our newest one. It's digital.
So now I've heard in the past complaints about, that pinches, or that, so talk about that if you would.
These machines have the ability, the paddles flex a little bit, so it's not as bad as the old machines that patients are used to. When the paddle comes down, it gives a little bit, and that helps for the comfort, patient comfort.
So you need to compress the tissue, so it's sort of, if you're shooting through part that's thick and part that's thin, you're not going to get an even picture, right? Okay, so you need to compress. So again, you don't want someone to be uncomfortable.
No.
But there's probably going to be a little bit of that, no matter what you do.
There's some uncomfortableness. We always tell our patients that uncomfortable and tight's okay, pain is not. Let us know if it hurts so that we can stop.
Okay. So how does it work?
Patient's breast goes on the table here.
Do you stand from the side or from in front?
They stand right in front here, and we control it with the paddles on the floor. It can go up and down for their height. We want it, they don't have to bend over or stand on their tiptoes. We control everything from down here. So we bring the paddle down, and it comes down, and it'll tell us how hard we're going down, but we pay attention to how the tissue looks and how it feels more than the actual poundage. We step behind the wall, and as soon as we take the exposure, it automatically releases and they can get out.
Okay. So how long do I need, if I've got to come for my mammogram, how long do I need to plan ahead? I mean, what you just did looked like that took about 30 seconds.
Yeah, the whole thing, we tell people about 15. We have them usually in and out in 10, but just in case, 15 minutes gives you a good time. If that's all you're having done is a routine mammogram, 15 minutes is all you need.
So if something comes up that maybe it's questionable, whatever, what happens then? I mean, I say this because it's happened to my house. And so you don't want to be, well, let's look at it 3 weeks from now. We want to know right now. We want to get this fixed. If there's something that...
So when you come in for your screening mammogram, you get your 4 pictures. Our radiologists read them at a later time. They don't read them while you're here. Your doctor will get the report, and you'll get a letter at home stating that you need to call your doctor or you need extra pictures. A lot of the times people come in and it's nothing. It's just normal breast tissue that just looked different on the picture for some reason. The patients come back. We do the special views that the radiologist wants. While they're here for that, they do look at them while they're here if they get called back.
Okay.
And then if they need to do any extra pictures or an ultrasound, we do that at the same time too. But that's for a diagnostic if you return.
So like a regular screening thing, you go, I forget what the rules are now, but you start when you're 40?
Start when you're 40 and every year.
Okay. Now, if there's a family member, your mother, your sister, your aunt, grandma, whatever, maybe that puts you in a different risk category that maybe you need to go?
Yeah, we always ask those questions. We let the radiologist know that you may be at a higher risk. It doesn't change when your screening is unless your mother had breast cancer at a very young age. Say she was diagnosed at 40. Most doctors will start you at 30. At least with one, just to see what's going on.
So now that this is a computerized, we were talking about that with Terry a little bit ago, but computerized now, can they find last year's exam and the one before that and the one before that and then call them up and compare them?
Yes.
If there's one spot that was questionable, whatever, we can look at that?
Yeah, we've been digital now for 6 years. So we have 6 years worth of digital mammograms if you've come every year that we can compare them to. If it's older than 6 years, we have our old school film ones. We get those out and they can look at those too.
Kayla, let me ask you your opinion about something. So when you hear mammogram, is that something, again, that's, I don't think I want to do that because I've heard it hurts or whatever.
It's just not something that you look forward to, thinking about it. I mean, especially I'm 21. I don't want to look 20 years ahead to having to come in and start doing that.
Is it 1 out of 8, 1 out of 9 women at
I
some
think
point?
In this area is 1 out of 8.
1 out of 8
Eventually,
women?
as you get older, your chance of breast cancer just increases. So when you're in your 80s, your chance to be diagnosed is like 80%.
Wow.
So it's better. It doesn't pinch as much as it used to.
Yes.
It's still so okay. When you're hopefully everything's good with you and your sister and your mother, and when you get to 40, you'll go for the first time. But it's something to do, right? I mean, it's not something where I don't want to know. I don't want to go get the test.
No, it's still the best screening tool out there.
Well, thank you, Jill. It was
You're
nice
welcome.
to meet you. We appreciate it.
Sure.
So Jill, where are we now?
We're in our stereotactic biopsy room. This is where we bring patients when the radiologist sees calcifications that he wants to biopsy.
On the mammogram.
On the mammogram.
So what's the calcification have to do with anything?
Calcifications can be markers for cancer, teeny tiny calcifications all grouped together. 80 to 90% of them are benign, but it's those 10 to 20% that aren't that we need to get out, test them, and make sure it's not cancer.
So you said the word biopsy. So that means to be taking a little specimen and sending it off to the lab for them to look at in the microscope, right?
Yes.
How does that happen?
The patient lays on their stomach. We have a hole in the table, and their breast actually goes through the hole in the table.
Okay.
The table comes up in the air, and we work underneath them. There is a paddle down here that is similar to a mammogram machine. We put the breast in compression just like we would have for the mammogram, only it has a small little window. We want to find those calcifications in the little window. Once we find those calcifications, we take a couple different pictures, one straight on to make sure we have it. We take a couple angled pictures, and there's some calculation that goes into that to see how deep they are. And it shows the radiologist exactly how far to go in to find them.
So stereotactic, that's what's zeroing in from so he knows exactly where to go.
Yes.
Now, can he see while he's putting in the needle? It's a needle that takes the biopsy?
It's a needle he puts in. It's not like live pictures. We take still shots like a mammogram. And so he looks at the pictures before he gets started and then numbs the skin like any other biopsy. Goes in with the needle. There's numbers down here that show him just where he's going. And then once we get to the spot that he wants, it starts to take samples. And he controls that. It takes about 12 samples. Needle goes in once and it turns on its axis, so it doesn't have to go in multiple times to get samples.
So let me ask you the question I asked you a few minutes ago. I've been through a mammogram. There's something we're questioning about. So we come here, so it's like, so I'm pretty nervous now by this point. Now, how am I going to get the news? What's going to,
These we have to send off to pathology.
Okay.
So typically takes about a week to get the results back from pathology, and that'll go through your doctor.
Okay. So the exam goes right from, the exam tissue goes right from here to the laboratory,
yes.
And then they've got a process that they've got to go through. And again, that's not something there's all kinds of things that have to happen over there. So, it's not something, so this isn't there's no stalling, it does, those things all take time.
They just take time, yep.
So does this one get scheduled way in advance, or does this one happen after we have a question at the mammogram?
This one doesn't usually happen same day. It's possible. It takes about an hour. So if there's time and the patient has time, we've done it before same day. Most of the time we schedule it. Usually don't have to wait long, maybe a couple days to a week, if that far, to get you scheduled in to come. So
let me ask you, and maybe this is maybe hypothetical, but do you typically see somebody that come in for their first mammogram when they turn 40 and we got a questionable spot, we better follow through on that? Or does it usually not happen that way?
Not usually, but occasionally you do have somebody. A lot of the times someone will come in for their screening mammogram. They don't have anything to compare it to. So a lot of the times they may get called back for extra pictures because they don't know what their normal breast tissue looks like. Breast tissue is so different from person to person. But that's usually where it ends. They usually come back, they confirm it's normal breast tissue, and that's it. And now they have something to compare it to. So next year when they come back, they can say, yep, that spot was there before, it was normal breast tissue before, and they don't need to work them up anymore.
This is going to sound like a kind of a weird question, but what if the spot is like maybe real close into your rib, and you can't really get it in the mammogram? Can you get to it here?
If you can't get it in the mammogram, it's pretty hard to get here. Okay. That's where ultrasound comes in.
Okay.
Ultrasound can get back farther.
Well, we'll look there next.
Yeah.
Thank you.
You're welcome.
Jill, you're back.
Yeah.
What are we looking at here?
We're looking at our bone density machine. Patients lay on the table here, and we check to see if they have osteoporosis.
So bone density, do you look at a particular, like one bone on everybody, their leg bone or their hip bone or something?
Yeah, to stay consistent in the way the machine's set up, we do their lumbar spine, we do their left hip, and over 65 we do their left forearm. Well, we do the non-dominant forearm.
So if you're right-handed?
Yeah.
Okay. Why is that?
You use that one less, so it would actually have the least amount of bone density compared to your dominant hand. Any weight-bearing exercises increases your bone density, which is a good thing. So you just use your right hand more, and so you'll have more bone density on this side than this. So
bone density exam, so we're going to look at the bone tissue, the bone structure itself, right? Mm-hmm. How does that work? How's that?
The machine does most of it, actually. We line up the patient and scan it, and the machine takes calculations and reads how much of the radiation goes through the bones as opposed to being absorbed by the bones. Kind of gives them an idea of how dense it is.
So what puts me to be a customer for this when I start to get older?
Yeah.
Maybe if I've had some other treatments that might
Right.
have affected that?
Yeah, if you have been on medication that can lower your bone density, they may start you on one earlier. The highest risk is women after menopause.
Okay. So is there, I mean, I'm making this up, age 50, should I be thinking about that's when the time is to get the first one?
I'm not sure
or?
what the guidelines are for men. We don't have as many men that come in. Like I said, women, it's after menopause, your bone density typically goes down. Men, it's usually family history, a medication that you have been on, steroids will lower your bone density. So
Really?
if you've
Well,
taken
that's
those a
interesting.
lot, your doctor may feel you're at a high enough risk to have the test done.
Let me ask you something that you said a minute ago. If I have things that put more resistance on me, that's going to help me avoid bone loss?
Yes.
That seems like backwards. Doesn't
Yeah.
it? You know, it's like if I don't stress myself,
Yeah.
I'm going to be.
Right.
It seems like I should take it easy to be stronger down the road, but it's the other. It's the other way around.
Yeah, weight-bearing exercise is good for you.
So at any time, at any. So now I've heard people say, check it with your doctor and make
Yeah.
sure. So I'm sure that's your heart
Yeah.
and your lungs and everything are okay.
Exactly.
But for your bones, you want to do now as that. And that could be something as simple as like, I don't know.
Light lifting, garden work probably would even help.
Can I use those gummy bands and can I
Yeah.
use those? So it's resistance. So I'm going to work with resistance. So.
Yeah.
So, Kayla, do you do that at your school when
I
you're
do.
doing exercise things?
Yes, I make it to the gym and I try to get in some light lifting whenever possible. Are there certain nutrition guidelines that you also recommend for people who have problems with bone density?
The doctors have those recommendations. We don't give out any recommendations as far as that goes.
When you
Okay.
when you find somebody, do you find them because they've broken something, or because, or you want to head it off up front so that you can get them to the doctor to
Yeah,
get that?
most patients come in as screening exams. We're looking to find it before they actually have osteoporosis.
There you go. So you don't want to have that broken hip.
Right.
You want to head it off, right?
Yeah.
And I know there's medical treatments, there's diet things you can do, and you can start lifting weights, right?
Yes.
Well, thanks again, Jill. That was great.
welcome.
Very informative.
Thank you.
So Terry, what's up behind us?
This is the region's only 3T MRI.
So what's 3T? What's that mean?
3T is Tesla, and 3T Tesla is the strength of the magnet.
Okay.
So-
So the stronger the magnet, the better the test you're going to get?
The better the detail, yes.
So now we're standing kind of far away from it. I mean, does it make enough magnetic force that you have to be cautious about being around it?
The magnet is shimmed, so you can actually walk around it, but if you get to the end of the table here with anything magnetic, it will suck you right in.
Okay, your telephone, your wedding ring,
Anything.
your watch, all that
It'll
stuff.
pull bobby pins right out of your hair.
So take all that stuff before
Everything.
you come.
Yes.
So what about maybe I have dental work, or maybe I had an orthopedic thing and I've got a prosthetic. Or
It depends. A lot of them are already tested for MRI. A lot of them are not steel anymore.
Okay.
Your dental work is usually gold or silver.
That doesn't matter with the magnet.
Nope.
Okay. So
matter.
the stronger the magnet, the better the results for the doctor's going to be able to see things better.
That's right. The better the detail, yes.
So I had an issue with my shoulder a few years ago, and that was the only time I ever was in one of these things, and it was really noisy. So I want to ask you about that for one thing. But I mean, the doctor showed me the picture after, and you could clearly see the thing was torn there,
Yes.
which I don't know that an X-ray. I don't know that you've been able to see that any other way.
No, your basic X-ray is going to show you soft tissue and your bone structure. The MRI actually is sort of like, works on the same principle as the CAT scanner that we talked about. It will also cut you in slices.
So it's like I could see the labrum, I think is the name of the
labrum,
thing.
yes.
You could see the thing. You could see the tear clear as a bell on the pictures you showed me. So it's like, wow.
Rotator cuffs. I mean, that's one of the main things we do in MRI.
So I don't want to go to surgery if something really it's just bruised or it's going to get better on its own. But then after we had the MRI, then I knew, okay,
It was time.
we have to have that fixed. So I assume that happens a lot.
Very much so.
What kind of stuff? Orthopedic stuff? What?
Our bread and butter is orthopedic. We do knees, lumbar spines, cervical spines, shoulders. A lot of with this 3T, we can do hands and fingers. The detail in the extremities is just outstanding. Our radiologists are very happy.
Now, a person that gets claustrophobia again, and when we looked at the CAT scanner upstairs, it seems opener.
It's short.
and narrower. Now this one's a little bit longer, but it's more open than the one I remember going in that was over at the hospital.
This has a wider bore. This is actually called a wide bore, and this suite that we're in actually has a patient experience module in it. You can see the different colors. You can probably not see it, but there's an HD TV on the ceiling.
Ah, okay.
So a patient can actually come over here. There's a monitor here. They can plug their iPhone in. They can, if they have videos down, they can stream them on the monitor up there. Again, it reduces claustrophobia.
So do I have to have my head in there? Can we just put the part in there that's got the problem?
It's exam dependent. So sometimes you do have to have your head in there. Other times you don't.
Okay. So, and again, to me, that's much larger than the one that I use at the hospital, which is, I guess that's a good thing for those folks.
Yeah, and most people, they'd rather go in feet first. It seems to calm them down rather than going in head first.
Now, what about the noise? I mean, I remember going through that thing. It was very loud. Why is it so noisy?
The noise is, they're called gradients. It's, if you think of as kind of a laser pointing, we pinpoint the organ that we're looking at or the body part, and the gradients actually excite the hydrogen protons in the body. So we're hitting a certain area with is radio waves.
Okay.
Radio waves and magnets. That's how we produce.
And so that electrical stuff just makes noise. So then those
are the gradients. They're called gradients.
Is this one noisier than the other one? Less noisy than the other one?
It's less noisy.
Same. Okay. Kayla, what do you think about an MRI exam?
Well, there's one question that I've been thinking about. How long does it take for this whole procedure to happen? If there's a TV in there and you can listen to music?
There is a TV on the ceiling, but it's body part dependent also.
Okay.
I mean, the average MRI will take about 30 minutes.
Okay. So you'll be in there for a while.
You will.
I was thinking my shoulder. I think I was there for 20 minutes or something like that.
And everyone keeps asking, oh, we have a new 3T. It's going to be faster. It's going to be faster. It's more about detail than speed.
Now, do I have to lay totally still for 30 minutes?
You do.
Okay.
Now
so maybe it's a good thing that the TV's there, because that's going to give me something that I'm not just sitting there,
The technologist will speak to you through intercom, and they can tell you, go ahead and relax. We're going to start the next series in 30 seconds. So you have time to maybe do a little shuffling, but not a lot.
So is it getting busy? Is it getting used a lot
busy,
here?
yeah. We're averaging we do about 13, 14 patients a day here, and another 15 at the hospital a day.
Okay.
Wow.
So yes, from 5:30 to 5, we're open up here.
So same question: is there one that's better to come here? I'm making this up, an orthopedic thing versus an internal?
It is. We have a criteria, and again, when the physician calls to schedule it, we go through our criteria and we'll say you're going to go to Liberty Street, you're going to come here.
Okay. Now I asked you this before, but does this put any stress on me? Does this put any lifetime exposure to radiation?
Nope.
We want to any stress that comes. I mean, I can get
all
this
All the studies to date show that you can go in there even as a pregnant woman, except for your first trimester. They still are kind of shying away from that.
Interesting. Well, so that's the latest and the greatest, huh?
This is the latest and the greatest. There's no other magnet. The next closest 3T MRI is in Pittsburgh.
Okay. We'll see. I bet they're jealous of us because we got a newer one than they got, right?
Meadville Medical Center has it, yes.
They're the latest and greatest one. How about that?
That's right.
Very good. Well, welcome back, Terry. That was really interesting. I learned a lot today. So I hadn't seen the new MRI machine. I remember having the test myself. We talked about, and this one looks different. I mean, it looks less scary,
intimidating.
Yeah. I don't know. What did you think, Kayla?
I thought it was really cool getting to see all the different machines.
You've heard of them before, right?
Yeah, I've never seen one up close in person, so that was a great experience.
Well, see, now down the road when you're working as a hospital administrator, you'll be hearing this stuff and it's like, oh, I know. I've known about that for a long time.
Yeah.
As an up-and-coming hospital administrator, she'll be saying, these are too expensive. I'm not buying these. We do have expensive toys. Radiology has expensive toys.
Yeah.
Okay, so Terry, one more time. If I've got to have a test, what do I do?
You will have your ordering physician call the scheduling line. Now, general x-rays, like your basic chest x-ray, hands, feet, extremities, that type of thing, they do not need to be ordered. You'll get a script from your physician, say, hey, go get a chest x-ray, and if it's at your leisure, come here.
Okay.
I mean, you can walk in. We're trying to funnel a lot of our outpatients.
If I
up
go to
here.
the hospital, there's been a car accident. I'm probably going to end up waiting in line
There is.
behind all the things coming through the ER, right?
That's right. I mean, here you can walk in. We have a new registration area here. We'll get you in and get you out.
So women's imaging moved up here,
Correct.
and that was a very impressive tour we had there. So all of those tests are going to be done up here now all the
Yes.
time. Can any of those still be done at the hospital?
Only thing that will be done at the hospital is a specialized study that it's a needle localization, which then we place a needle into the area of interest, and then that patient goes right to surgery.
Okay.
Everything else will be done up here.
So you have your choice, but hey, you're better off coming to Vernon Place because you're going to get in and out quicker, right?
And it's a beautiful building.
And you got a nice fireplace. It's
Yes.
kind of cold today. We're getting
That's
warmed
right.
up here, and so. Well, thanks, Terry, and thank the staff for us. They all,
I will.
except for Jill. They all went.
Yes.
They all went and hid, I think. So
That's
we appreciate her. We appreciate her. She was, she
did a
was
great
right,
job.
right in there. So, and thanks to the folks at home for joining us. And we'll talk to you next time on Medicine in Meadville.